topic this morning. We are going to be discussing an introduction to stem cells and regenerative medicine. My name is Salmaan Dalvi, and I am the Chief Executive of the Global Society for Regenerative Medicine. We are based in London, England, and we have offices across the globe, namely in Africa. We have an office in South Africa. We have an office in India. We have an office in Pakistan, as well as New York. The idea today is to make people or the audience get familiar with stem cells and regenerative medicine. Both are integral subjects. One is, you can call it stem cell therapies, you can call it stem cell regenerative medicine. The reason for the topic itself is the body goes through degeneration, and all diseases are degenerative diseases. And we would like to make sure that the body's own building blocks can regenerate the body that is what would be the optimal way to lead into a good, healthy life. So, what are stem cells? Stem cells are the body's building blocks. They are cells which are unlike other cells and they have specialized functions. These are basic cells, and under the right condition in the body, these cells can divide into more cells, which are called daughter cells, either because either of these daughter cells can self-renew and become more specialized cells, or they such as blood cells, brain cells, heart cells, eye cells, and they do this to be able to help the body to renew and restructure itself. So why is there such an interest in stem cells? Everyone talks about stem cells these days. Everyone is trying. There is a big field of stem cells outside, and everyone wants to go into stem cell therapy. What is the real reason? Well, from a research and a doctor's perspective, let me say that the two things. One is, for the researcher, it increases the understanding how a disease occurs. By watching stem cells mature into cells in the bone, we know how the bone structure is. We know, if we look at the stem cells, uh, how they develop in the heart, we know how the heart functions, how the heart degenerates. If it is nerves, if it is the skin and skin tissue, if it's other organs, we get to know how and understand how diseases occur and what conditions and how they develop. So that's why stem cells are very important to us in the lab or as doctors. The other reason is, if you can generate healthy cells, this can be replaced and regenerate a tissue. So, for example, if you have got degeneration of the knee, and if you can get stem cells and you can plant them into the knee or transplant them into the knee, the knee can be healed. There is no need to have artificial limb transplants or artificial joint transplants. You don't need to have those. So, using stem cells to regenerate uh, a part of an organ is a lot more natural. It's a lot more better, and that's why there is a lot of talk these days about stem cells, and there's a lot of interest in stem cells and stem cells. So people would ask me questions, and I think the question is, are stem cells used to treat patients then? Is that what I am saying? Or is that what the belief is? Well, doctors perform stem cell transplants every day. These stem cells, before we go into that, there are two types of stem cells, two derivatives. These are adult stem cells. We're not talking of embryonic stem cells, which are normally not used these days. We're talking of adult stem cells, which could be in peripheral blood, in bone marrow, or could be collected using cord blood. So, yes, transplants using adult bloods are done on a daily basis. They've been done from the bone marrow. Stem cells have been used for transplant to damage cells that have been damaged by chemotherapy or diseases such as cancer. And what happens over there is you take about a liter of bone marrow or 400 mils of bone marrow, and you would then process it from a donor or from the person themselves, and it would go back into the body, and the cells would generate. Okay, this is being used. This has been used for diseases such as leukemia, lymphoma, neuroblastoma, multiple myelomas. These stem cells, we use adult stem cells over there, which are from the bone marrow. So what would happen is the person would either be a donor or get a donor if it's an allogenic transplant, uh, and you would go into a bone marrow registry, and you would get a match for someone or for similar tissue type to yourself, and you would then be able to use the cells for the bone marrow transplant. Organizations such as the Anthony Nolan, who do a very good job on this, have got a huge registry, and the World Bone Marrow Registry has also got about 20 million plus people registered who are bone marrow donors. The other part, which is of interest, is suppose many people in the Middle East uh, or in the Arab world would be able to talk about is cord blood stem cells. Everyone wants to store their own cord blood. Cord blood is a unique product in itself. Okay, when I say it's a unique product, it means it's an off-the-shelf product. What happens? The stem cells that are there, that the baby is feeding on, the blood that the baby is feeding on in the placenta before it's born, is very rich in high, good quality stem cells. Once the baby is born, the placenta is expelled about 9-10 minutes after after the birth of the baby, and that is normally discarded. In there, before the blood that remains in that placenta is very high in stem cells that can be used for stem cell transplant. Hence, there are many companies in the globally who store cord blood from mothers who have just delivered. And it has become an industry in itself whereby people want to store their own cord blood so that they can use it for either a family member or the child itself in the future. That is something that is possible. Particular in my particular subject, I would say stem cells from cord blood can be stored. However, the cost of stem cell transplant has to be met. So, not all cord blood that is stored may be used today. And when you want to store the cord blood, and if you store the cord blood, have you considered the fact that when you use it for treatment, you will also have to pay for the treatment? So, it's a very good idea to have cord blood stored if you feel that you can afford it. But the idea for stem cells, stem cell medicine, or regenerative medicine, and to regenerate cells is to make sure that there is affordability and there is accessibility both together for everyone. It's not a domain of the rich, it's not the domain of a few. When these cells, hematopoietic cells, basic cells, can help regenerate and help in society to help cure conditions such as leukemia, such as sickle cell disease, such as thalassemia, such as diabetes. Go and help heal wounds, which are diabetic ulcers, help with shrapnel injuries, help with keloids, help with dry eye disease. Okay, there are a vast number of diseases that can be solved and that can be helped using stem cells and stem cell transplant. Then it should be that everyone should have the opportunity to use these cells. So there are currently a number of clinical trials being undertaken. There's over 9,000 clinical trials which I looked up on at some level. Some are in clinical stage 1, some are in clinical stage 2, some are in clinical stage 3, some are going through the RMAT process, and that they will revolutionize the medicine of the future, gene therapy, stem cell therapy, regenerative medicine will become something of will it's not in will be used in the distant future. There are the cases that I know, and when I use stem cells, and when I was involved actively in stem cell transplant, was we would use a mother would who would have, say, sickle cell, had a child with sickle cell. I'm remembering a particular subject, a particular client. 3-year-old child had sickle cell disease. There was no chance of getting a match, and the same child was a match was the parents had a second baby. They could not. That was not a match, so they decided to have a third baby. The third baby was a match to the first one, and they decided to store the cord blood. We decided to use the cord blood from the third baby's placenta and then use it to to help the child who for the sickle cell disease, who had the sickle cell disease. The transplant were very successful, and when I saw the child after about 3 months, 4 months, this little child was was so happy, and he said thank you. And I couldn't understand at that stage that how can a 3-year-old child say thank you when he doesn't know what it was going through. The parents explained to me that the child had a stroke before the third birthday. Okay. And my staying up 2 or 3 nights, making sure that we collected the right amount of cord blood, and then transplanted it into this particular child, or gave the child a new lease of life. It's amazing. It was an amazing story, and it gave me a reason to say, yes, this can work. I've also seen patients with leukemia, with sickle cell, with thalassemia go through the same processes, and when they go into full remission, these people are so happy, they're so grateful, they've got a new lease of life. So, yes, stem cells are the future of medicine. If you collect stem cells or you get an opportunity to donate stem cells, I would suggest that you go onto a register. Anthony Nolan in the UK do a very good job. Global registries do exist other places as well, and try and join your register or get in touch with the Global Society for Regenerative Medicine. We also try to help people get accessibility and affordability into stem cell medicine. What is our role as an organization, as a society? Well, we our role is to educate the general public on the development of stem cells and the development of in the regenerative medicine fields. We work with organizations globally who are doing research on a daily basis, so we know what's happening. We have got our pulse on the buzzer. We also know the fact as stem cell medicine will cost, and the cost of stem cell medicine needs to be borne by someone. So we have a membership package for our organization for people who are interested in stem cells to get regulated stem cell therapies. If they want and they want to have an affordable therapy to be used, then you can get in touch with us and we'll be able to suggest methods and ways to do that. So all in all, very short introduction to the stem cell medicine. Yes, it is here now. It has been used for over the last 10 to 15 years. There's a lot of talk about it, but there are people who practice it who are not regulated. So you've got to be very careful that you need to go through regulated stem cell therapies. People who are regulated should be the ones who should use it. There are regulatory bodies who make sure that there's quality of stem cells is there. So there is a possibility of storing it for yourselves. There's a possibility of joining a bone marrow registry. In the UK, you've got the NHSBT, which has got its own collection points. Anthony Nolan is a global agency that's available. In America, you have the NMDP, who are also responsible for stem cell transplants. So, as I have explained, all of this is possible, and you can you can get stem cell transplants. This was a short introduction. And I hope you've enjoyed it. If you have any questions, we'll be able to discuss them at the end. I'm happy to take any questions. Thank you.
So we've been listening to Dr. Salmaan Dalvi about an introduction to stem cells and regenerative medicine. I'm delighted to have Dr. Dalvi here with us now for some questions and answers. Good morning. It's great to see you, and it was a fascinating presentation. We've got a lot of questions coming in from our audience, so we'll start with the first one. What are the challenges facing stem cell research at the moment?
The challenges, financial for one. Okay, that's a nice and simple one. If there is not enough money, there's not enough research, or research has have got to go through ethics committees, get approvals. Those are the ones. I think that would be the biggest challenge, is being able to get enough finances, enough funding for the research to go ongoing.
So,
it's a nice and simple question.
Yeah. Yes, that's absolutely great, Salmaan. What's the ultimate aim for stem cell therapy?
What's the ultimate aim for stem cell therapy? Wow, that is a $1 million question. What's the aim? Majority of diseases that we have currently are degenerative diseases, from aging to knee problems to heart problems. Everything as the body gets older, it starts to degenerate. The aim would be to have regenerative medicine and regenerate each organ. So each organ, each part of the body. For example, we have if someone has a diabetic ulcer, and there's millions and millions of people in the Middle East who have diabetes, and if you can regenerate diabetes and stop diabetes, that as a cure, that would be fantastic. That is fantastic. And on the other hand, those people get side effects of comorbidities such as diabetic ulcers, and to be able to regenerate and re-heal those wounds would be just one example. But it could go on for heart disease, it can go on for autism, cerebral palsy, all the leukemias, all the cancers, millions of cures. So yeah, there's 7,000 rare diseases globally. And if you could get stem cells used for each one of the 7,000s, then the 7 billion global population could be connected just with using stem cells.
And this is not life change. It's not sort of. It's life changing for these individuals that receive this stem cell therapy. I mean, it's life enhancing, isn't it, for a lot of them? I mean, for illnesses that could be terminal.
Absolutely, absolutely. I mean, I look at it in my career, and I was new to stem cells about 15, 20 years ago, and we just did I was in a labor ward in one of the London hospitals for 36 hours because a child needed stem cells, and I said, okay, we'll collect it for this particular consultant. And we did the collection. 36 hours later, it was in labor, the placenta was delivered. We got 70 mils. I thought that was very good for a transplant. It went out, got the transplant done, and that was it to me. I was, it's all done, fine. 3 months down the line, and in those days, consultants ruled. Consultant called me up from one of the hospitals and said, look, we need you to come over to our hospital within the next 2 hours. I had to drive down there, and after a lot of being pushed around by the consultant and being given vague stories, there comes a 3-year-old boy and says, Doctor, thank you for saving my life. This is the child who had the stem cell transplant. But what does a 3-year-old know of stem cell transplant? And the boy is now about 18 and is in remission, 18, 19 in remission completely, leads a normal life. That is life-changing. That is life-enhancing. And if everywhere, I mean, the African continent is huge. You've got millions and millions of people who are suffering from sickle cell. The Arabian Peninsula has got thalassemia as a disease, diabetes, as I mentioned earlier. If these diseases could be on a daily basis, it will become very affordable to treat stem cells because someone has donated them or someone has given stem cells. It's amazing. That's what real humanity is all about. We've seen that in the pandemic now when people are trying to help each other. Sometimes I do feel clapping hands and clapping utensils for NHS care workers, yes, but those people do 24/7 hard work. Just clapping is not a very good, is not enough.
Yes, obviously you want people to donate their stem cells. So we've already found out that I'm too old to donate my stem cells. And there is an age limit there, isn't there? Just tell us the reason for that.
Yeah, the reason for the age limits one is if by going on the bone marrow registry as we grow older, to obtain stem cells you have from people who are on the registry, you have to hospitalize them for a few hours. You may need to take blood. And as we grow older, our stem cells, again, that are there as with age, they degenerate. And the pain that is there to get involved, the pain threshold is not as good as someone who will be 18 to 20-year-old or 35-year-old. So that's one of the reasons that you have and we get diseases ourselves after a certain age. We get older. So all of those things will make a difference.
So we need to encourage more young people to go onto that database because constantly that database is getting old and the older end of the database drop away, don't they?
Absolutely. We need a lot more people to donate stem cells. And if you are on a register, it helps. Okay. If you yourself are a young mother and you have the facility in your country to donate stem cells to a stem cell bank from the placenta, then that's also very welcome, providing you meet the criteria for that. Then it becomes an off-the-shelf product. Cord blood stem cells are off-the-shelf product that sit in a lab, and as soon as there is a need for it, you can use it.
Okay, and these aren't just transported locally. Stem cells can be transported globally, can't they?
Stem cells are transported globally. It's surprising that yes, we do a lot of transplant. A lot of transplants are done in the UK, but majority of the cord blood transplants, or majority of the cord blood stored in the United Kingdom, is from people of Asian origin who store it for themselves, and then they take it back either to China to get the treatment or to India, which are Hong Kong, Singapore. So yes, and obviously in Middle East, I get patients from Middle East who have come for stem cell transplants to the United Kingdom. So yes, people from Dubai and Sharjah have come. So it is a global movement.
Yeah. So that you've got the donors, you get the stem cells, you find a match. And the stem cells are used for treatment. So what's the success rate of stem cell therapy?
Well, the success rate depends on many different things. Outcomes are very good for for things like leukemia, sickle cell anemia, thalassemia, but there may be some comorbidities. You see, people don't die of stem cell of any diseases. They may be dying of the comorbidities that are there with the illness. But wherever I've seen stem cell transplant, if it is, the rate has been 80%, 85% success rate straight away to up to 100% in many cases. It depends on which disease is being looked at and where stem cells are being looked at. For example, stem cells, I'm not talking futuristic, but if it is a shrapnel wound or a burn wound, it's 100% by grafting. Okay, so then that's what would be you take the stem cells from the amnion and you use them, or you use a stem cell for dry eye therapy. They're 100% treatments.
So which country has the most advanced stem cell therapy system? Which country is far ahead, way ahead? Obviously, you're going to say UK here.
No, it's very difficult to say that because good work is being done globally. Japan, Korea, United States, In the UK, we are doing extremely good work as well. Israel is doing some fantastic work. Even Iran and even the Middle East, okay, have got centers that are doing good work. The question is funding for the research. Okay, as I said earlier, I started it off. The obstacle is funding. If there is funding, and if there is a global movement, and which is now there, the global society that I work with, whereby you have funding for the treatments as well, in the form of a warranty that will be allowed, or that will allow, then life becomes easier. But yes, stem cells are used globally. United States obviously claims to be the leader. Russia and those areas, China claims to be a leader. There's thousands and thousands of papers out there, and people are doing work. But the idea is to have regulated stem cell therapies. Don't go to a clinic that suggests, oh, I can do stem cell therapy for Alzheimer's, but and you pay $3,000 and get a treatment, and then 2 months down the line, you have got to pay another 3 months, another $3,000 for a booster dose. That's not the idea. The idea is to get a treatment. Yes, it may be six doses for a particular treatment, but they can be done. You don't charge people accordingly. You tell someone, this is the charge, this is what it is, this is the affordability of it, and then you carry on. And currently, 1 month is $3,000, the other month is $5,000, and there's a lot of clinics who are duping people because the results are not there. You should always look at, is this clinic reputable? Is this area, is the work being done really correct? Is the doctor reputable? Who has, how many papers have been published by this doctor to be able to say that, yes, I can do this particular thing? Because it's very easy to collect something and just inject it and say, yeah, I can work, I work, but we need to know outcomes. You asked the question, what is the success rate? Success rate, outcomes are very important.
Yeah. And you talked there about it being you're from a global society. You want countries to communicate with each other about this. You want this to become a global result whereby the affordability isn't a factor. It becomes accessible to all. That's the key, really, isn't it?
That's the key, because the cells are within you. Okay, every country has got a major cell bank in itself. If every country was to provide enough funding for their centers and say, okay, stem cells can be used for this, so we will say knee replacement, so much a fund for knee replacement. Diabetes will allocate so much. This will happen. This will happen over the next 10 years, 12 years, 15 years. And for those countries that are not there, that don't have a healthcare system like we have in the UK, we will have people wanting to join or take a warranty out, who will say, okay, we will, providing today you don't have a degenerative illness, you pay, say, £10 a month or $20 a month, and if you were to get a degenerative illness in 2 years or 3 years time, there will be a pool of pot, maybe $50,000, maybe $40,000, and that would be available to pay for the treatment or costs around the treatment, and that will make it affordable for everyone. Someone from Africa or someone from Bangladesh or the poorer third world countries should be able to access stem cells as much as a person from the United States or the Arab world.
Yeah. So what's the one key thing that you want our audience to take away from your presentation today?
The key thing is, if you have the availability and therefore to join the global register, and please do that. And if you don't have that, try and donate and talk about it with your friends, that global regenerative medicine is here. It's going to be the future of medicine. Stem cells are the future. So please just communicate, talk about it, make it an issue, make it a global issue, just like we've just done with the pandemic and the COVID-19.
Yeah. So thank you so much for your time, for your presentation, and for answering those questions for us today. That's Dr. Salmaan Dalvi from the Global Regenerative Medicine Society. Thank you.
Thank you, Sandra. Thank you very much.